Even though we are in the midst of a pandemic, people still need help with mental illness and substance abuse problems. Intermountain Hospital has responded to COVID-19 and remains available to you. So Renee, help us understand how the admissions process to Intermountain Hospital looked before the COVID-19 pandemic.
Before this pandemic hit, it was pretty casual, just like anywhere else that you would go. People would come and go pretty easy, walk in the front door, check in with the receptionist, and then we'd get started with their admission process.
And so tell me though, how has that changed now that COVID-19 has occurred?
So we are kind of practicing a lot of the standard precautions that this pandemic has brought about in the way of practice, social distancing within the hospital, doing COVID screening prior or with patients, and pretty much everybody that comes to our hospital gets the screening through our COVID tent that we have out in front.
So Renee, help us understand, what can a patient expect when they arrive to the hospital right now, especially from that street-to-door process?
When patients come here either from the street or from another facility, they come in through our COVID screening tent where they are asked some questions about their where they've been in contact with other people, what is their risk of that, and then we look at their symptomology, see if they have any symptoms. Once they've passed that screening, then they're able to come into the building, they check in with the receptionist, and they are greeted by my reception team, or my admission team rather. Then they go through another medical screening process, and then the admission process kind of starts from there.
And is that pretty much the medical screening process then they can expect when they arrive, or is there more in addition to that?
So there's kind of two screenings. The first COVID screening, which happens outside the hospital, and then within the hospital we conduct another medical screening to ensure that the patient doesn't have any medical emergencies.
Okay, and at this time, are all the Intermountain Hospital services still available?
They are. All of our inpatient services, our adult mental health services and recovery services are all available, as well as our intensive outpatient and partial hospitalization are all currently still in service.
And if people watching right now need to reach out to you for help, what should they do?
They can go to intermountainhospital.com and they can even submit a question from there to the contact us form. They can also call 208-377-8400.
Great. Renee, thank you so much. Greatly appreciate your time.
Thank you.